On this episode, two medical mysteries that defied the experts.
She looked like nothing we'd ever seen before.
The doctor's eyes went from normal to about the size of a ping pong ball.
What's going on? What are we looking at? Why is one leg bigger than the other?
When Elena Gallus is born with a series of shocking birth defects, her entire family is forced to face a frightening reality.
I was terrified because I didn't know if she was going to live.
We called a lot of friends and said it's time for prayer.
Then, newlywed Sadie Jones thinks she has it all, until she's suddenly faced with a series of terrifying symptoms, which doctors believe are all in her head.
The pain got so bad that I thought I was having a heart attack.
Her hair was just starting to fall out. I was constantly worried whether she was okay.
It felt like I was just screaming at the top of my lungs and nobody was listening to me.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery.
In the fall of 2003, Andy and Tyra Gallus were happier than they'd ever been. They had just moved into a new home in Zanesville, Ohio, and were looking forward to filling it up with children.
We both wanted a family with the white picket fence happiness kind of thing that everyone wanted.
He was happy, and they were a nice couple together.
When I found out Tyra was pregnant in December 2003, I was very excited.
I was like, okay, let's go. We want to be the normal grandparents. We want to spoil this baby rotten.
I always wanted to be a dad. Was just ready for the moment to be there, that we'd actually be one big family.
Andy would tell us that the doctor said everything looks good, going as scheduled.
Nothing could have prepared the family for what happens next. Just a month before the baby is due, Tyra begins experiencing severe labor pains, and Andy races her to the hospital.
The doctor had come into the room to give her a shot to calm down her labor and stop everything. And I told the doctor that we should probably do an ultrasound, make sure everything was okay. I just wanted them to look and just see what was going on, because clearly the little one didn't want to be in there no more. After a little bit of a heated discussion, he decided just to make me happy, he'd go get the ultrasound machine. When they did the ultrasound, the doctor's eyes went from normal to about the size of a ping pong ball.
According to the images, the baby is in distress. To save her child's life, Tyra will need to undergo an emergency C-section.
Tyra was scared when they told us about the emergency C-section. It was just hurry up and get to the other room as soon as you can.
Andy rushed out just long enough to tell us. The look of shock on his face spoke volumes. Just 1,000 thoughts run through my head all at once.
The medical team whisks Tyra away to the OR. And within minutes, Elena Gallus is born, weighing 6 pounds, 8 ounces. And it's clear that something is very wrong.
The first time that I saw Elena, it was quite a shock. She looked like nothing we'd ever seen before.
You could definitely tell that one leg was noticeably bigger and a little longer, and some of her toes were fused together. I was very concerned at the time, but I knew if I freaked out, everyone else was going to start worrying.
Her skin had purplish marbling to it in a design, actually kind of a checkerboard square. It was feelings of numbness to look at her and think, what's going on? What are we looking at?
But before the medical team can even begin to assess the newborn's bizarre appearance, Elena suddenly stops breathing.
I was excited to be a dad when they'd first taken Elena out, and then instantly terrified and scared because you could tell that she wasn't breathing, she was barely moving.
Elena's lung has collapsed, and the medical team is racing to re-inflate it.
It was the longest wait I think I've ever waited through, because we thought, is our granddaughter going to make it?
The family watches helplessly as Elena is transferred to the neonatal intensive care unit.
After Elena was stabilized in the NICU, Andy came out to the waiting room to his mother and I. Emotionally, he broke down. He was really choked up.
The doctors couldn't tell us exactly what was wrong with Elena because none of them had seen anything like that at the time, and they had no clue of what was wrong with her. And they decided to do a few CAT scans to see if they could narrow down what had caused everything.
And they were kind of consulting back and forth with other colleagues.
But with each passing day, the medical team is no closer to understanding Elena's case. Each and every test comes back normal.
We decided not to go home because we figured it was a lot easier to be there at the hospital than be 8 miles away, just in case anything did happen. So me and Tyra stayed in the waiting room for the next few days. When we went to the waiting room to stay in there, there was a couch and a few chairs. And since Tyra had to have surgery to have Elena be born, I let her sleep on the couch and I slept on the floor for a couple days.
At that time, I think Andy was doing very well with handling the stress with all the information that he had just been given in a short amount of time.
Totally overwhelmed, the young parents do the best they can to keep it together.
Tyra was doing pretty good during the majority of this when there was other people around, but when she was on her own, you could tell it was worrying her a lot. She just was keeping it to herself. It was a scary moment because I was staying strong and not showing any emotion to keep everyone else hopeful and not worrying about nothing. But on the inside, I was terrified because I didn't know if she was going to live.
Finally, after 10 agonizing days, the doctors have a solid theory.
And they finally said, this is what we believe she has.
And they diagnosed Elena with Klippel-Trenaunay syndrome.
Klippel-Trenaunay syndrome, or KTS, is an incurable genetic disorder in which the blood and lymphatic vessels grow uncontrollably. Purplish skin, fused toes, and enlarged limbs are common, and in severe cases, heart failure can occur.
When they told us the diagnosis of KTS, of course it was shocking because we thought, oh my, what is that?
I wanted to know what all caused this and is there any way to take care of everything. I was worried about not knowing what her future was going to hold, if she was going to be able to live the normal life of a little girl, if she was going to be able to play sports if she wanted.
Even more disturbing is the prognosis. Elena's leg could keep growing until it becomes so big she wouldn't be able to use it and would ultimately need an amputation.
It seemed like time stood still, not knowing how to handle it.
That really hit home and hit hard. We were deeply concerned about Elena. Andy pretty much just said, why has this happened? What have I done so wrong that I deserve this punishment? And our response to him was, this is not a punishment. You need to look at this as a gift, because that's what she is.
When we found out that there was no cure for KTS, we got scared. It was even more alarming to know that the disease could get worse.
We called a lot of friends and said it's time for prayer because we didn't know what the next step was.
While they will have to watch Elena for potential heart complications, the medical team is confident that her health is stable. And 2 weeks after her birth, she's discharged from the hospital.
I was overly excited to finally get to go home and just start working on being a family and getting even closer. But it was no shorter than we left the hospital. The excitement of taking her home did change. The sheer terror of not having a doctor over your shoulder that could help you just in case something did happen.
Eventually, the young parents are able to relax and settle into life as a family of 3.
I love kids to death, so it was pretty easy to step in and be dad. She gave me a lot of joy, a lot of energy. I'd come home, me and Elena play on the floor. So we were very hopeful for her when she got older, that she'd just be normal, crazy like her dad.
We would go to visit with them every week or so, and it was fun to go and play with Elena and watch her to see what types of advances she's making.
But it's not long before the infant's disease begins to take on a life of its own, just like the doctors predicted.
When Elena was around 3 months old, she was at home. We noticed that her leg had gotten about double the size it was when she was first born.
So that was a concern. We just sort of wondered what's going to happen.
We had a lot of friends that had kids and newborns, but they couldn't relate to the same things that we were going through. They would tell us, we know exactly how you feel, and we'd look at them in confusion and say, you have no clue what we're going through or how we feel and the questions that we have, and we'd eventually get a sorry from them, but it wasn't their fault. They didn't know any better.
In time, the stress of caring for Elena begins to take an enormous toll on the young parents, and they make a painful decision.
Me and Tyra were going through some difficult and stressful times, and realized the best thing for us and Elena and everything is if was just to get divorced and go our separate ways.
The stresses of a newborn and financial burdens alone would have been enough stress to drive anybody apart.
It was kind of a shock. I didn't expect it, but it was for the best.
Overwhelmed by the challenges of raising a special needs child alone, Andy decides to move in with his mother and father.
I was excited to be able to be there more for Elena and be able to help with some of the extra duties that come with having a special needs child.
Andy is especially grateful for his parents' help when the size of Elena's leg begins to affect her development.
Around the time Elena was 6 months old, we were noticing she was having a hard time sitting upright on the floor by herself. I was a tad worried and confused, so I took her to her family doctor.
The doctor explains that the bigger and much heavier leg is throwing Elena off balance and recommends she begin physical therapy.
They started her out with working with her motor skills and picking up blocks. It was a little sad knowing that she couldn't do everything she wanted to do as fast as she wanted to do it. I was worried, wasn't sure what was going to happen.
Over the next 3 months, the family does the best they can to help care for Elena, whose condition seems to be getting worse by the day.
You could really see that leg growing, and it was becoming even more obvious that it was much, much larger.
I was concerned for what was going on. It was more worry of not knowing the answers to the questions that I had.
And of course, our concern was, will she be able to stand? Will she be able to walk? Elena's doctors at the time were involved with NOVA, the National Organization of Vascular Anomalies, and they suggested taking her to the medical convention.
Just a couple of months later, Andy and his parents meet Tyra at the convention, hoping to learn more about how to help Elena.
We went expecting to get more information about how to provide her better care.
It was great to meet some of the families down there. They were very open to tell you their experiences.
We were able to see their children in different stages of development, so we felt more relieved about Elena's future.
They broke the convention down into groups so that the doctors could evaluate the kids individually.
They examined Elena and they looked at her and they said, this child does not have KTS.
The team of medical experts is confident that the purplish marbling on Elena's skin is not typical of KTS.
It was a moment of shock. For so long had a name to put with it, but now we're back to square one pretty much.
Then all these questions come back. Well, what is it? Could this be life-threatening? What are we facing now?
It was back to the confusion of what's the outlook for this? Is it going to be something that's worse? We just didn't know at the time.
We felt like we'd just dropped back and started all over again with a whole new set of questions and no answers.
Their suggestion to us was to take her to the Cleveland Clinic. They do a lot of genetic work there.
Anxious to finally find out what's really wrong with Elena, the Galluses immediately make an appointment with Dr. Rocio Moran.
Dr. Moran put us very much at ease, and she made us feel we were part of the team. She valued our input right from the beginning.
We thought, okay, here's a doctor that's going to work with this little girl, and it's all about Elena now.
We spent a lot of time taking the initial history and all the different evaluations that she has had prior to seeing us. So we asked questions about other organ systems to see whether or not they might be involved. We obtained blood to screen for genetic disorders that might explain her medical problems.
Several hours later, the family heads home. And with each passing week, they pray that soon they'll have the answer they so desperately want. 2 long months later, the findings are in.
I diagnosed Elena with a Proteus-like syndrome.
Proteus syndrome is an extremely rare genetic disorder in which parts of the body mature abnormally. In healthy individuals, genes act as a set of instructions for the body. They tell it how to grow and function properly. But in patients like Elena, her genes malfunction, causing unusual development.
The classic presentation of Proteus syndrome is the disproportionate overgrowth, and it needs to be asymmetric. So it's not that both your arms are affected or both your legs are affected, but it's really a patchy distribution of findings, as well as skin lesions that are abnormalities of the blood vessels, veins, or arteries. So this disorder is extremely rare, and it's pretty devastating. The one thing that most patients with Proteus struggle with are the physical deformities that are caused by the syndrome.
It's the same disease that afflicted Joseph Merrick, the Elephant Man, and the subject of the well-known film. He died when his head grew so big that the weight of it snapped his neck.
It sounded like it was out of a sci-fi movie. I just remember with the Elephant Man when I was younger, they'd take his growth out and it would eventually come back too, and things on him would change. It seemed like the stories were kind of close. It takes a good bit to scare me. It was a moment of shock.
I think there's a significant psychological impact of identifying a diagnosis, and I think the Galluses were relieved to be able to put the proper diagnosis to what was causing Elena's medical problems.
The Gallus family is grateful to finally understand that everything Elena has experienced since the day she was born, from her lung problems to the strange discoloration of her skin, is a direct result of the condition.
The physical manifestations of this disease are pretty obvious. Her blood vessels are not normally formed, so that can lead to the significant birthmark that we see on Elena's body.
Her most shocking symptom, the oversized leg, is part of the same pattern of excessive growth.
One of her legs was much larger than the other. The concern is that her limb asymmetry, or the unequal size of her legs, will continue to worsen over time. Because of the progressive nature of her condition, she may need to have her leg amputated if the growth is not stopped.
I freaked out because it was going to be my little girl.
Not only will her leg continue to expand in size, other parts of Elena's body will also grow, including her internal organs.
One thing that really scares us about Proteus is that things can change unpredictably in the body, and not knowing what could happen to Elena, it did scare us.
I was scared and worried, not knowing what the next answer was going to be.
One of our most significant concerns is her risk for clots and for having a fatal complication as a result of those clots. The blood clots usually go to the lungs, and they have what's called a fatal pulmonary embolism.
It kind of took me by surprise.
Dr. Moran explains that unfortunately, there is no cure for Proteus.
It's a feeling of uncontrol when you can't do anything to make somebody better.
So aggressive management is very important to keep Elena healthy.
It's imperative that the medical team keep a close eye on Elena so that they can help manage her condition. In addition, Dr. Moran encourages the family to continue taking her to physical therapy.
Elena reacted really good with physical therapy because she's a really big people person, so she just looked at it as a new person to play with. So she picked it up pretty quick and did really good.
And finally, more than a year after most babies, Elena stands up.
When we got to that milestone, it was a real celebration.
The first time I saw Elena stand up, it's just too hard to really describe.
She was just just elated. She was tickled pink. It wasn't long after Elena got her first pair of shoes that she started working with her therapist, and they started using a gait walker.
It was about the second or third day of her having it. She was walking all over the living room without any help, just holding on to her little walker. The first time Elena walked without her walker, we were all lucky enough to actually be in the living room when she was doing it.
We didn't think she would ever reach that point in her life either.
We were elated because that was the milestone that we were all concerned about.
Elena's progress is encouraging, but because her disease is so rare, there's no way to know how much she can accomplish.
The reality is that Elena has a disorder that affects the growth of her body. But at this point, we really don't know what the future holds for Elena.
And while the Galluses are grateful to finally have a diagnosis, they can't help but wonder why it took so long to find a doctor who recognized the disorder.
Many of these disorders have overlapping features, so what might be present in KTS may also be present in Proteus and may also be present in other overgrowth disorders, so that makes the diagnosis very difficult to make. There's probably around 200 people in the world with Proteus syndrome.
In 2004, 19-year-old Sadie Mills was a happy, healthy nursing student living in the small town of Weatherford, Texas, and working toward the dream she'd had since she was a child.
I decided I wanted to be a nurse when I was probably about 6 years old.
And another dream seems to be coming true when Les Jones, a paramedic, enters her life.
I met Les as a student in college. As part of one of my classes, we had to ride on the ambulance with the paramedics and assist patients. I rode out on his truck, on his ambulance. We dated for 2 years. And one day he took me to my favorite restaurant in Fort Worth, and he asked me to marry him, pulled the ring out of his pocket. We were married December the 16th, and it was a very small wedding at my mother's house. It's really sweet. Everything was going as good as I could expect it. I was in college, and Les had a good job. We had just got a new house.
Little does she know that her world is about to begin spiraling out of control when she's struck by a frightening sensation in the middle of the night.
I woke up suddenly like somebody stabbed me in the chest, is the way it felt. It felt like my throat was on fire and my mouth was on fire. Never had anything like that before. I reached over and grabbed the bottle of water and just drank as much as I could get down, and it just immediately relieved the symptoms. I thought maybe it was heartburn. I was able to fall asleep probably within about 5 or 10 minutes of drinking the water. I felt completely normal when I woke up the next morning.
But over the next few weeks, the heartburn-like pain returns and keeps coming back.
It just came without warning, the heartburn. It didn't matter what I was doing, where I was, it just would hit me. I just figured that because I had gained some weight right before Les and I had gotten married, and I thought that going from, such an extreme, that maybe that's what was causing it. And I started taking at least a half a bottle of antacids a day. Nothing was helping.
Then, one day in early spring, while she's grocery shopping, a terrifying incident sends Sadie reeling.
I remember going into the grocery store to get groceries, and Les was with me, and all of a sudden I could feel the heartburn coming on, and I knew that something was wrong. The pain got so bad that I was just standing in between aisles, just kind of gripping the shopping cart, just shaking. It scared me to death.
She got very pale. Her forehead got really sweaty. It was obvious that there was something going on.
Les didn't know what was wrong with me. I couldn't even talk. I thought I was having a heart attack.
Alarmed, Les rushes his wife to the ER.
It felt like a lot of pressure in my chest. A lot of burning and tingling.
The on-call physician immediately performs a series of tests, but there's no sign of any cardiac disorder. However, the doctor does have a hunch about what's causing the pain.
He thought that maybe I could have an ulcer. I had to have a blood test. It took about 3 weeks to get the results back. The test came back negative. I didn't know what to make of it.
Over the next 2 weeks, the heartburn-like attacks only seem to intensify. Then, one Sunday night, Sadie is jarred awake by a bizarre new symptom.
I felt like I was drowning. It felt like somebody poured a bucket of water on my face while I was asleep, and I was choking, I was coughing. I had realized that I had thrown up in my sleep, so I ran into the bathroom to clean myself up. And I was afraid that if I went to sleep that I would do it again. I was very embarrassed. Like I wet the bed, but I didn't. That's kind of how it felt. It was just as mortifying.
Frightened and bewildered, Sadie makes an appointment to see her doctor the very next day.
The doctor thought maybe it was because I drank so much water right before I went to bed. He told me to try to keep from drinking anything after about 7 o'clock at night, just to kind of ensure that I'd have nothing to come up in my throat.
I'm a paramedic. I'm not a doctor. I'm not going to question what the doctor says, right off the bat.
But just a few nights later, Sadie wakes up again to find herself drenched in water. And when she makes an appointment with her doctor, he can find nothing wrong and assures her that it's just stress.
The doctor just kind of didn't seem to really take us very seriously. Basically, it seemed like the doctor was telling us there's got to be something that's causing it. It's got to be something that you're doing that is making you feel this way.
It felt like I was just screaming at the top of my lungs and nobody was listening to me at all. Nobody could even hear me.
Over the last 4 months, nursing student Sadie Jones has been suffering from excruciating heartburn, and she's just started vomiting water in her sleep. Her doctor is convinced that stress is triggering everything, but Sadie's husband, Les, isn't so sure.
I told Sadie whenever I saw it that I don't know, what's going on. I don't know what this is, but that's not normal.
Basically, I wasn't sleeping more than just a few hours a night at that point because of all the heartburn and the throwing up. And I just started feeling very tired and lethargic when I was, going to class.
As her medical problems started getting more frequent and more severe, it got to the point to where I was seeing her with a book studying less often.
Usually am at a 4.0, and I had started making B's and C's on tests because I was just too tired to study.
She was exhausted, she was depressed. Watching my newlywed wife go through all of this and knowing that there's nothing that I can do to fix it, seeing that happening was horrible.
During the day, Sadie drags herself from one class to the next. But in the evenings, she begins to notice a bizarre new development.
I would be eating something, and I felt like I would get too full, and water or food would come up into my mouth. It wasn't digested at all. I knew my food wasn't going into my stomach, and that scared me.
She didn't feel good because she didn't know what was going on. She was honestly frightened, and you could tell that she wanted it fixed.
I just was very, very tired of it. I didn't know what to do anymore. I went to the doctor and told him I'm throwing up everything I eat. I am hungry and I can't eat anything. He thought that I was just getting really stressed at school or something. He said that it was all in my head. I kind of started just suspecting maybe that is what it is. Maybe I am crazy. I don't know.
But just when they think things can't get any worse, Sadie develops another humiliating problem.
One day, about 6 months into having the heartburn, I was in class and all of a sudden I got this really loud hiccup. And these were just, they wouldn't quit. and they were extremely loud and embarrassing. I couldn't get them to stop. I was just sitting there thinking, what am I going to do? I need to leave class. And it lasted all day long. It was very weird. I'd never had anything like that happen to me before.
And it's not long before the embarrassing episodes are happening several times a day.
Nothing really seemed to relieve them at all. It hit me in the middle of a test, and I would have to get up and walk out, which you're not allowed to do.
She would shudder whenever she would hiccup because it was so violent.
I looked it up on the internet, and it said that people in stressful situations can get really bad hiccups. I just figured that's what was causing it.
As she started having more problems, she got to the point where she didn't want to go out. We spent a lot more time at home than what we normally did.
I was very embarrassed by the whole thing, and just being married, you want to go and have fun and be together. I was emotionally drained. I felt like I wasn't even me anymore.
After living with the strange symptoms for more than 6 months, Sadie is hoping that a drive to the country will cheer her up. But nothing could have prepared her for what's about to happen.
We were driving, and then I kind of felt uncomfortable, like I had drank the fizzy stuff off of a soft drink or something, and it was kind of just in the back of my throat.
Sadie had a feeling like she needed to burp, but she couldn't. So I pull over on the side of the road, and she opens the door. It was like she was vomiting, and on the ground beside her door was a big pile of bubbles, like the head on a beer.
Like dish soap foam. It was really thick foam.
She looked like she was scared to death. We had no clue what was going on.
Over the last 8 months, a seemingly ordinary case of indigestion has escalated into a nightmare for Sadie Jones. She suffers from attacks of intense heartburn-like pain, violent hiccuping, and an inability to keep any food down. And now, during a drive to the country, Sadie has started spewing soap-like white foam.
It made me feel like we've got to find, we're gonna have to go to the doctor with this. We've got to find out what's going on.
I went into the doctor's office and I told him I can't eat anything. I'm losing weight. I've lost like 10 pounds just this week alone. And he said, kind of sounds like you have an eating disorder. I said, well, I'm not making myself throw up. It's just, it gets too full, or I feel like I'm too full and it just comes up. And he said, well, it's probably something psychological, and a lot of bulimics do that.
I was very angry. I tried to keep my composure as best I could. I told the doctor it is not bulimia. She wants to eat. She can't eat. She is not getting the food into her stomach, guys. She is not doing this on purpose. I was insulted because the doctor's just not seeming to believe what's going on.
He said to come back in another 2 weeks to see him if it got any worse, and he also had told Les to watch me as well to see if it was an eating disorder or see what I was doing. I didn't know what to do. It was frustrating. I didn't know what else to tell him without it sounding like I was crazy.
Over the next 2 months, Sadie does the best she can to grin and bear the incapacitating symptoms.
I probably lost about 35 pounds by that point. I felt very, very weak. I would break out into tears in the slightest little thing.
You could tell she just didn't look as healthy as she did before. Her skin didn't have the glow that it used to have. She could run her fingers through her hair and she would have a wad of hair in her hand. Her hair was just starting to fall out.
I was a hermit stuck in the house, afraid to go anywhere. I couldn't even let my husband hold me at night.
That was the major turning point because I wasn't gonna watch her do this anymore. I called and made an appointment with our family doctor. Either our doctor was gonna tell me what was wrong with her, or he was gonna send me to somebody that could.
Once Les got up and was telling him, "You're going to do something about this," the doctor said, "Okay, well, let me go make a few phone calls," and called one of the local gastroenterologists. He said that this doctor can see you today, and that's how I finally found Dr. Huggins.
When Sadie presented to the office, she had a variety of complaints, and there was a great deal of urgency, primarily because of her extreme weight loss. 30 pounds in a young individual oftentimes is a red flag that there's something serious going on.
He said that he thought that he might know what it was, and he had to make sure. I could tell by looking at his face that he didn't think that I was crazy.
We wanted to go and look into her esophagus to see what was going on. So we scheduled an endoscopy. Basically, an endoscopy consists of taking a small tube and placing it down through the esophagus into the stomach.
My first thought was, for the first time, somebody seems to know what's going on.
We noticed that her esophagus in particular seemed more dilated than the typical esophagus. In addition, we felt that there was a decrease in the overall activity typically seen.
When I woke up, Dr. Huggins was standing there with my husband, and he said that his suspicion was correct and that he knew exactly what it was that I had.
Over the last year, Sadie Jones has been enduring a humiliating and mysterious disorder that doesn't allow her to keep food or water down. Now, she's finally found a doctor who thinks he knows what's wrong with her.
For the first time in a long while, I felt like everything was going to be okay.
After assessing Sadie's symptoms of vomiting, reflux, and inability to swallow, in addition to the endoscopy findings, we were able to make a diagnosis of achalasia.
Achalasia is a rare disorder of the esophagus. In healthy individuals, the esophagus, which is made up of muscles, relaxes and contracts to move food and liquids into the stomach. But in patients like Sadie, the muscles are unable to do their job. As a result, anything that enters the esophagus cannot pass through to the stomach, producing a major blockage. Ultimately, the patient is forced to expel the content.
It felt wonderful to finally get a diagnosis of what this was, because it just took so much out of my life.
He pulled all of those symptoms that she's been having into one diagnosis, and they're all tied together.
Achalasia is progressive. You can have spasms of the esophagus in achalasia. These bouts of contraction can be so severe that she will have intense pain, very similar to what one experiences with a heart attack. These cycles of vomiting that Sadie was experiencing were an attempt to evacuate her esophagus. She would accumulate food in the esophagus until it reached a critical point, and at that point it would try to clear itself. Hiccups is a common manifestation of achalasia. The foam that Sadie experienced was produced by the salivary glands, and it was the body's attempt to respond to the irritation of the esophagus.
It was just really nice to be able to find out what was causing me all these problems. Finally, now it all makes sense.
Fortunately, Sadie was diagnosed in time, before the disorder got even worse.
If she hadn't been diagnosed, it probably would have led to a hospitalization, considering the amount of weight loss and the degree of dehydration which she had experienced.
My first question for Dr. Huggins was, how do we treat this now? Are we going to be able to cure it? He said that it's not curable, but he could try Botox injections.
So by injecting the medication into this area and thus achieving relaxation of this area, we remove the biggest problem from achalasia.
Once Dr. Huggins administers the injection, Sadie feels the effects almost immediately.
After we left the surgical center, we drove to the house, and She ate and she's like, oh my God, I felt it going in my stomach. She didn't get sick.
It felt wonderful. I was just happy that, now I finally got my life back.
Following the injection of Botox, Sadie continued to improve drastically over a 3-week to 4-week period of time.
How long the Botox lasts varies from patient to patient, but Sadie will need treatments every 4 months or so to keep her symptoms in remission.
Over time, you'll have to go back and re-inject that tissue and achieving the same goal again and again.
While Sadie is thrilled to be eating and sleeping again, she and Les can't help but wonder why it took so long to put the pieces of the puzzle together.
Over the last 14 years, I've seen approximately 20 to 24 cases of achalasia. The disease isn't very common.
It is such a rare thing. A family doctor is just not going to know what achalasia is right offhand. So I was lucky to find a gastroenterologist that knew what that was.
Today, Sadie is fully recovered, busy once again pursuing her studies to become a nurse and living her life to the fullest.
It's been about 2 years since the diagnosis, and the Botox seems to be doing a really good job right now, and I live my normal everyday life like I did before.
Sadie is my best friend. She has been since we first started dating, and I can't think of ever being without her.
I just think that, if you go to a doctor, and they just are not figuring out what's wrong with you, go see another doctor till someone sits down like Dr. Huggins did to me and actually listen to what you have to say.